Test 1 1, test 1 1. Test 3 3, test 3 3.
have them on.
We have a quorum, so I'm going to call the meeting to order. And thank you. Welcome to our February 23rd. Is it 23rd? Meeting. 23rd. Finance. Joint Finance and Planning Committee meeting. Do we have any question or any modification with the agenda? If not, we're going to proceed as posted. And at this point, if you don't mind, I'm going to turn this over to our chair, Mr. Petty, for the planning session first.
You'll do your minutes?
Oh, the minutes?
I see, he really trying to give it to you.
I get paid extra.
Okay, we don't have any citizen wishes to address the committee, so I'm going to move to item number 3, approval of the minutes.
Move approval.
Second.
All in favor, say aye.
Aye. Aye.
Opposed, same sign. Motion pass. Next, I'll turn this officially over to you, Trent.
Thank you, Mr. Chairman. Facility update today. One of the things we want to be able to do is periodically bring the board and the committee updates on the structures and the work going outside. So Bill has prepared a PowerPoint presentation. Bill, good morning. Please walk us through the update.
Sure. Yes, sir. Mr. Chair, thank you, Trent. Let's see if they come up here. All right. All right. We have 3 main projects underway. Included on your iPads are some of the pictures, but we also had a little bit of video that we have, so that's why we're also doing it on the projector here. The 3 big projects that are underway are the Psychiatric Emergency Center, Medical Home at Southwest, and then the temporary parking lot. And just to give you an idea of some of the progress as of February 21st, I have some photos up here of what's going on. And right now, we talked about the PEC, but I really want to emphasize, we're working on the PEC connector, which is going to connect the new building, which is the PEC, to Trinity Springs. So if you look on the top of this, on the bottom picture here, right behind the blue fence, you can see those, and I'll have video of this later, but you can see those, the rebar that's in the shape of a column that's going to be sunk in there to support the structure. So that's what's going on right now. So if you've kind of been by and wondered what's going on, progress is happening, but a lot of it right now is on the foundation. And what I did, construction officially kicked off for the PEC on October 26, 22. We're scheduled to finish May 26 of 25. So just kind of using that timeline, if you want to get in your mind where we are in the timeline, we're around 13% complete. And so most of you know that I was trained as a CPA, and so I did come in and take a sample from my office window of what's going on. So the video you're seeing playing here on 3 different days, so the 16th and then again on the 20th, to show that there are workers out there and there are tractors, and there's one of the pylons they're working on, the rebar that cement will go in and support the pylons. And then just to make sure it wasn't a fluke, I did a 3rd day. So I have 3 good samples, and you can definitely see semis are there delivering stuff. So work is occurring occurring and didn't want anyone to think that progress or construction stalled. Just some of it's not as visible as we would like. Yes, that was me walking with the buckets. Yes, teaching. Now, unfortunately, the medical home did get off to a little bit of a slower start. We ran into some delays trying to get the grading permit just to get the site graded. And we ended up getting it on the Wednesday of the ice storm. So we had people in this room sleeping. Adam calls me at 7:30 at night saying, "Hey, Bill, good news, we just got the grading permit." I'm like, "Well, medium news, because we can't go out and start grading tomorrow because it's frozen." So, but we're pretty happy about that. And the timeline on that, we began construction on February 3rd, started staging the area, putting the fence up and everything, and then that's scheduled to be completed on July 24th of '24. So using that same kind of thinking for a percentage for you, where we are today is around 4% complete. Next is the temporary parking lot, and this is going along really quickly. We're actually around halfway done with this, and this picture on the left, if you zoom in on it, I mean, that is one of the I think a really cool picture of the progress. Shows the construction, all that, and then the Fort Worth skyline in the background. It's just a pretty attractive picture. So attractive that we actually put that on our social media feeds. And that's the other thing I wanted to mention, is that we are keeping all this information on Yes to JPS, on our Yes to JPS website. We're also posting this on our Facebook and LinkedIn and Twitter. So we are keeping our social media updated on the construction so that people will know what's going on. And then with that, I just will open it up to any questions. And
Questions?
Question, but take pictures out of your window, just call me. I drive by the site every day.
so, thank you, Reverend.
Eyes on that side, right? All right, thank you, Bill. Appreciate it very much. Well, we'll move now to consider recommendation for the RFQ award for the furnishing and furniture fixtures. Adam, please, sir.
Good morning.
Morning, Adam.
So we have one recommendation for selection, and that is for furniture and finishings. We had two respondents, one Corrigan Associates, the other Facilities Interior. Corrigan had a score of 81, Facilities Interior had a score of 39, and the committee is recommending Corrigan, and they did have a 30% minority participation. So.
And this is RFQ, right?
This is for a response to the proposal.
Okay. Any questions for Adam on this one? If not, we need a motion to approve this request. Go ahead, Ralph. Sure.
Two responders.
We go out to the public, and it just depends what we receive. Now, we have gone back out to the public when we received one response, which we were not happy with on a different proposal. But in this case, we felt that it was a legitimate proposal, and so we accepted that. Normally, we get 9, 10, 11, 12 responses for the A&E and construction. In the specialties, it's a little more narrowed in the field.
Yeah. What's the estimated cost of this package, Adam?
To be determined. We're not there yet. It's
Okay.
project dependent. I think for the medical home, we just went over that, and it's about $600,000.
Okay. So this is only going to be fixtures and furnishings for this building, not for the main campus or for the...
It's for all of it. It is? It's a enterprise-wide, but
Okay.
we will have work release packages that are budgeted, which we will bring each of those contracts as we move forward in the
That's
project.
surprising there weren't more. That's a big project. Other questions?
Yeah.
If not, we need a motion. Motion from Dr. Casey. Second from Zim. Any questions or discussion? All in favor say aye. Aye. All opposed, same sign. Thank you very much. Construction Manager at Risk RFQ for the MOB, Adam.
Yes, sir. So you may recall last week we came before you to ask for release for the RFQ for the A&E for the MOB. We're asking to release for the construction manager at risk. We time these as such so that we can bring this individual on time by the time we get the A&E package in, because they will advise on pricing and constructability. And it'll be similar for the next item as well. So that is what we're asking for, to release the RFQP.
Any questions?
Move approval.
Motion from Dorothy, second from Dr. Casey. Any questions or discussion? All in favor say aye. Opposed, same sign. That motion carries. Thank you. And construction manager at risk for the central utility plant.
So again, same, we have the EA that is going to the commissioners already, engineering architecture. We're asking to bring the construction manager at risk to go through pricing exercise as we bring those folks on board.
What's the timing on this one, Adam? When are you expecting to get the proposals and bids on this?
We have not put it out yet, so we're asking the release to put it out.
Okay.
But typically 5 to 7 months.
Okay, I was going to say it's later this year, right?
Yes, sir.
Okay. Any questions on the central utility plant? A motion?
Move to approve.
All right, Zim, Ralph for second. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries. Thank you very much, Adam. Bill, thank you.
Very much. Y'all have a good day.
Back to you.
At this time, I would like to invite our CFO for a CFO report.
Good morning. I've got a few things to update you about this morning. The first and probably largest question is about our pending bond issue. We had originally scheduled February 16th to go to market. The CPI numbers, the retail numbers, and the wholesale numbers came out about the same time, much higher than the market had anticipated. So we decided to delay for a couple of weeks and let the market start to stabilize a bit. Our decision was not specifically around the interest rate. It was about the ability to sell in the market all maturities. So there have been a couple of really large sales that have happened this week. So the market is stabilizing. We are talking daily, but we will probably not re-enter the market until next Tuesday, but we'll be evaluating it Tuesday, Wednesday, and Thursday of next week. So if we do decide to move forward, you'll get an email as you have, just as a general update of where we are. So the short maturities under 5 were not selling in certain issues. There was a city issue that went out on Wednesday before our scheduled Thursday, and they did not have any bids on their sale. So that was a big red flag. We had pretty much anticipated before the 16th that we would probably delay. So, but again, there were 2 really large issues that went out Tuesday and Wednesday of this week. Also kind of the middle range, I believe like 17 to 22 had a gap on bidding. So we want a lot of bidding, we want a lot of competition. It helps bring down our effective interest rate. And so, you know, although it is a bit unusual, that's why we have our advisors. And that was a unanimous recommendation for us to give it a couple of weeks. So we'll be out there soon. The second thing is, if you've been reading up on healthcare or politics or public policy, there is a strong belief that the public health emergency that started during the COVID timeframe, I believe in April of 2020, that gave us extra payments on COVID positive patients. It had probably the most impactful to JPS was some concessions around our IGT and the federal matching, which gave us a little bit more in some of our DISH and UC programs, as well as some delayed pool cuts 3 year. So far has been a budget additive, and we did expect that the PHE would end at some point. So I do think that we're in good shape. Again, we continue to watch. They're not going to make a decision on that until very close to May 11th. If they do extend it, it would be for an additional 90 days, and we'll keep you informed of that. And then also of note, we do have the December 31st investment report from Hilltop posted on your board portal. I don't typically cover that. That's just for your information. And Hilltop does present to the Finance Committee once a year, I believe in November or December. So just to keep you informed of that. Are there any questions on any of the topics that I covered?
I saw you sent out the investment report. I haven't read it yet. What are we looking like in terms of our longer term investments? Because, I mean, we've been sitting at zero for longer than I can remember now.
Oh, yeah, or 0.25, yeah. We're actually right around 2%. Please remember that as a public entity, we are subject to restrictions under the Public Funds Investment Act. So for those of you who participate on any other boards or even invest yourself, we cannot take any risk with public monies. They're highly restricted, investment grade, treasuries, AAA, and so the earnings on our excess cash are nominal sometimes. But you can tell when I show the financials, we did anticipate a couple of interest rate hikes, but we did not anticipate the 3 or 4 that the Fed has made this year. And those hikes directly impact short term. We typically invest under 2 years. Again, criteria as a restriction. But we have benefited greatly from some of those interest rate hikes, especially with short-term investments. So we're right around 2%.
Benefited greatly unless you compare what's happened to inflation and the cost of construction and the things that we're going to have to pay for relative to all of these improvements, because the interest
Correct.
rates are not going to cover.
Well, I was answering your question about what was going on with our investment income. Yeah, I'm not sure I would say that the economy has not benefited any of us in a great manner.
We'll take all you can bring us, Sharon. I mean, that's,
Yeah, I did just give you a bond report, so you've got to be careful what you ask.
yeah, absolutely. Thank you.
But yeah. All right. If it is okay, I'm going to go ahead and move on to the financials for January. So our month does not has not varied a lot this year. We do have some budget variances, but when we get to some of the graphs, you can see that we've been very consistent this year with some of our volumes. Again, our admissions are strong. Some of those are coming from a decline in observation. If you look over to the right, when you look at some of the occupancy rates, we still are very high. Those occupancy rates do include heads in beds. So you've got to think about not just the inpatients, but the observations, as well as the outpatients that may be in the facility at midnight. Our CMI has remained pretty constant, right on track with budget, and our length of stay, you can see, is right on budget this month as well. From an outpatient standpoint, again, very consistent volumes in ED and urgent care, and our clinics are up slightly from the prior month, both in primary and specialty. For telehealth, just as a point of interest, we are kind of right at around 7% and 10% respectively for primary and specialty as we move forward. And that has dropped off consistently from 2020, 2021, when we were able to reopen a lot of our outpatient facilities. In surgery, we've had an increase both in inpatient as well as the outpatient surgeries. And behavioral health has been strong as well. You can see that our clinic visits have risen as well as our patient days slightly. Some of our provider statistics over in the Acclaim continue to be right on budget this year. You can see how some of that volume is divided up in that lower left graph. And then financially, we continue to be strong year to date, and those, and I realize that connection number is pretty small, but we did have almost a 6% increase in the connection enrollees this month. Our patient care collections on the bottom left, there is a little gap, but we had such a strong month in December, and so far February has been a very strong cash collection month. So that's just a timing issue between December, January, and February. So right now we're looking at the consolidated income statement. This includes both the impacts from the medical center as well as a claim and all of the intercompany eliminations that happen as you look at the, similar to the audit at the end of the year. Right now, if you look at us at a combined operating income, we came in at 11.9 million compared to a budget of 3.5 million. Net patient revenue remains very strong. On the medical center side, a lot of that is attributed to increased volumes as well as increased volumes and kind of a mixed difference over on the professional side. We have implemented the new comp plan as of November 1st, and we're attributing some of that to potentially a little bit under budgeting for volume, but also kind of a change in the incentive, and have been able to pick up some net revenue there. The supplemental Medicaid funding, I'm just going to remind you, that is the HARP program that got approved post-budget approval. So that $2.5 million a month you're going to see throughout the year, that is paid twice a year, and we will begin to adjust that once some of those actual payments are realized. It's a new program, and I did not want to over-accrue that on a monthly basis. Our salaries are over budget, but if you think back to that first inpatient graph, as well as some of those stronger outpatient volumes, that overage is supported by those volumes. And our benefits are a little bit lower year to date, mainly in the health insurance. That is always difficult to budget. I do think that we do trend it, but we had just very low January activity, and so some of that is flowing through. We do have some savings in purchase service. If you look at that year to date, it's about $6.5 million under. There are some timing issues, so I think over the next 3 quarters, we're going to start to see some overages in purchase service just from a timing standpoint. So year to date, our operating income is 36 million compared to a 18 million budget. So we are about 18 million ahead. Again, prefaced with, I think there'll be some timing catch-ups over the next few months with some expenses.
The budgeted impact, or maybe even the non-budgeted impact of purchased services and supplies on the operating statement, or is that going to be limited to the capital until we make an official transfer of that? How's that going to work?
So most of the the projects themselves are not going to really impact operationally our income statement until the very end.
Okay.
Fiscal year 24.
Okay.
The medical home, I think, has about the last quarter for next year
Right.
will be live, I think, May or June. And then the PEC, I think it begins in 2025, fiscal year 2025. So you're not going to see a whole lot of activity. Our bond issue costs and some of those upfront consulting services do have to be expensed, and they've been budgeted.
Okay.
So as we incur those, you'll see those come through, and part of that is some of the timing that I'm talking about. But
You'll have at least 3 to 5 million impact on issuance costs whenever you sell these bonds, and that'll show up under purchased services?
I think some of it is in the other operating expenses, and there are some that will hit in purchase service. But I think the bond issue costs were estimated to be right around 2.5 million.
Okay. All right. Well,
Yeah.
I figured close to 1%. And that's combined. That's all cost relative to the issuance, right?
For the 450 million.
Okay. So
Yes.
as we then, I mean, if I'm understanding correctly, whether it is a service or whether it's a capital item or whether it's an operating item, and I realize operating is going to be pushed out further, but relative to the bond schedule, we're not going to see purchased services on the operating impact until 2025, even if what we're purchasing under the bond program is not necessarily a capital item.
Some of the expenses, when we turn the project on, you will have, like, we have a construction account
Right.
during the project period. All expenses will be put into there. There are some minor equipment items and expenses that will be recorded when the project goes live.
Okay.
So some of the parking will come on, but again, those
Right.
have been anticipated and budgeted for. And then the first large project to go live will be the new medical home at Southwest. So we'll look at that construction account, and there will be some expense that would hit in the month that it goes live. Again, we have anticipated those expenses. The timing may be off a bit,
Yeah.
and when it is, I'll point that out.
Yeah.
But we're not going to see that on a monthly basis.
Okay.
It does get captured, and then we record it and
Guess
go live.
the challenge that we're going to have is, as we continue to try to balance the operating portion of the tax rate against the climbing debt service portion of the tax rate, characterizing those operational expenses is a bit of an art, because we know we're going to have an increased debt service portion of the tax rate. And we know that the pressure on the budget is probably going to come from the O&M portion of the tax rate as we squeeze the balloon, right?
Right.
So I think as we walk through this and you take us through the financial statements for the next several months, if not years, to be able to differentiate those operating expenses that are a direct result of the capital expenditures from the bond campaign, help us to be able to understand what we're looking at in terms of potential impact on the tax rate and the changes that we might see in the tax rate. Because I think keeping those separate mentally is a good thing. Because if we get pressure to look at our O&M tax rate in the next budget cycle, we need to be able to make sure that we can illustrate the true impact of the capital projects on the O&M portion of the tax rate before, and most people are going to say, well, that's not going to impact us at all until after those facilities are staffed and there's people working, but that's not true. There's going to be supplies, there's going to be operating services, there's going to be things we have to do prior to that, that big expenditure hitting us, that if we can differentiate that when it comes time to look at the budget and the overall tax rate, we're probably going to be ahead, because I won't be surprised if we don't see new pressures on the tax rate next budget cycle. And this may it may help keep the process honest. That makes sense?
It does.
Okay. Thank you.
So just for a little background, and this might be too basic. If it is, I apologize. But we're at a tax rate of 0.2244. That's divided into two components that Trent's talking about. There's an interest and sinking fund portion that's typically set based on our debt service schedule, which will be increasing. You don't want to put too much in the INS portion, because you can only spend that on interest and required sinking fund deposits, which we really don't have those. So it's really an interest component for us. There's an operational component to that that's kind of the plug that we back into every year when the tax rate is set, and y'all approve that during the budget presentation. So we'll spend a little bit more time educating how we came to that INS component of the total tax rate during the budget. And I'll try to, as I get information, I will bring that, and I'll update you here.
I think that'll help us when it comes to illustrating how our budget, because it's going to be a very different budget presentation over the next couple of years than it has been for the last 20 because of this change. So
Yes, sir.
I think that's good. Thank you, Sharon.
You bet.
Sharon, I have a quick question for you around the salary and contract labor.
Yes.
The budget, is that the one that did include the 60 or 80 million dollars that we put on top of it, right?
Yeah, so the question was around the salaries, the budget of the 58.8 million up there, or the year-to-date of the 225 million. For budget, we did look at historically how much overtime and contract labor that we had been using last year, and we included that in the 23 budget. So we didn't layer on additional, I just wanted to make sure, but we did continue our run rate from 22. So it is a bit inflated from a budgetary standpoint if you look back pre-COVID in 20 or 21.
Is there a concern here? Because if you look at those two items, and it only represents to January, so if you extrapolate 2 more months at $1 million plus, so we forecast that to the end of the year, that would be another $22 million.
Because we're driving so much more volume through the hospital, there's a nurse staffing ratio, a patient to staff ratio that we do have to maintain. So if you go up to that top line, the net patient service revenue, we are collecting the 9.3, but we are spending additional amounts on staffing. That's really where our flexible costs or variable costs come in. So, and when I say it's supported by volume, I don't just take those dollar numbers and say they offset. We go through and we recalculate the budget based on the actual volumes that are going through each department, measure that against their staffing ratio, And then we say, okay, how many dollars would we have budgeted had we known exactly how much volume would be here? And we're under that flexed budget. So that overage is really directly related to our increased patient volume in both inpatient and outpatient.
Thank you.
Are there any other questions I can answer for you on the January results? I do need approval for the
Thank you.
month.
Motion for approval for the budget. All in favor, say aye. All opposed? None. Motion passed. Thank you, Sharon.
That's one thing about these little fancy. I'm making things big that I haven't been able to see before. Okay.
We're going to go to 7B.
Yeah, so I have two supply chain contracts that are up for renewal. The first one is the wound therapy systems that we use here in the medical center, where prevention of blood clots for patients post-surgery or who will not be moving around a whole lot, as well as those related disposables that come with each stay. This is with KCI. It's $571,000 annually for 3 years, a total cost of about 1.7. This does lock in some guaranteed pricing, and KCI is a Vizient vendor.
Any question or comment? If not, we have
Move
motion.
approval.
All in favor, I say aye.
Aye.
Opposed? Motion passed. Item C, please.
This is for Curry Medical Specialties. They have they are the incumbent vendor. They are also on Vizient for $218,000 annually. This is a 5-year term, 3 years initially with 2 one-year extensions, which puts the total projected cost of the contract just over $1 million. There are a lot of pumps that are around the medical center. This allows us to refresh the pumps, and also there's a clause in the contract that would allow us to kind of a forgiveness for lost rented pumps at the beginning of this contract as well as at the end. So it includes both the pump rental and the sleeves that are disposable.
Any question, comment? If not, we have a motion for approval.
Second.
All in favor?
Aye.
Oops, same sign. Motion passed. Yes, sir.
For Sharon Lee. This past Saturday, Commissioner Brooks had prostate cancer event, and JPS was present. And a couple of gentlemen came up and was ready to complain concerning JPS, JPS connection, and the faults of it. And they approached Commissioner Brooks, and he says, no, the right person to complain to is right here. So he points at me. But I just want to say the staff is to be commended on what they did. Every question and complaint that they had, the persons had, staff had an answer. And not just an answer, but they had the solution and said, we're already doing that. We're already doing that. We have this in place. This is going on. And finally, I'm not calling names, but I know the staff. Finally, young lady says, evidently, you didn't look at your paperwork. And so it boiled down, because when he approached, he wanted to demand Commissioner Brooks to get him on the agenda because he wanted to come with persons to complain. And when we finished, he left not complaining. So I just wanted to commend staff on how well prepared they were to talk about JPS, the JPS Connection program.
Thank you.
Yes, thank you.
Thank you for sharing that.
All right. We are going to move to the next item, D, Ms. Parker. You have the next two.
Okay. All right, good morning, everyone. I'm here on behalf of our CNO, Jill Farrell, who's at Nursing Forum, and I'll be presenting a few contracts on her behalf. The first one, seeking your approval, is for an agreement with Neurophysiologic Monitoring Services, agreement with Neurodiagnostic Techs and the district. This provides neurophysiological monitoring and provides patient safety as we're providing neurological, spinal, vascular, and ENT procedures for our patients. This neurodiagnostic was awarded through the RFQ process, and the cost at $188,000 annually is included in our operational budget, with a total possible 5-year cost of $943,000, a 3-year term with a potential for 2 1-year renewal options. So, any questions on this contract? This is an incumbent provider, Hub certified vendor.
Second.
All in favor?
Aye.
Opposed? Motion pass. E, please.
All right, thank you. This next one is, I'm bringing forward for you to consider for approval the Fourth Amendment to the purchase agreement between Alcon and the hospital district. And this amendment is a 1-year extension option of the original contract that was awarded through RFP process. This extension will allow for a new RFP. And this purchase agreement, this provides ophthalmic implants and supplies for the organization. And the cost is also included in our operational budget.
And there's no increase, will it stay the same for the extension?
Yes, sir, as far as I know on this, yes.
Represent a 3% increase.
Percent
And
CPI.
for this extended year, which is acceptable. Move approval.
Sorry.
All in favor? Say aye.
Almost missed my cue there.
Motion pass.
All right. This next one is approval of Q-Site service agreement with Owens & Minor. Owens & Minor was awarded through RFP process. This provides electronic implant and tissue tracking as well as purchase order generation to assist with inventory, tissue, and implant tracking management. This is at a cost of $122,000 annually, which is included in our approved operational budget, and does have with a total possible 5-year cost of $610,000, and it is a 3-year term with potential 2 1-year renewal options.
And this one is under Vision also, right? Do you know, Joy?
I do not see that in the notes. I do apologize, but we can verify that.
I think they are, if I'm not
Okay.
mistaken.
I'll take your word for it. Move approval.
All in favor? Opposed? Motion pass. The
I'll make
next
sure and
item,
take all these back to Jill. I'm like, Jill, I'm taking these forward for you. But we'll verify. I'll be able to answer that question by
think
the
you're
end of
okay.
today. So that's all I have.
hello, Celia, how are you?
Good morning, everybody.
Morning.
I'm here today to present to you all a contract for consideration for the approval of a professional services agreement for inpatient mental health services for involuntary commitments between MHMR of Tarrant County and the Tarrant County Hospital District. The revenue for this, for the FY23 fiscal year is $6,563,490. This will allow JPS to be reimbursed by MHMR for providing inpatient mental health services for patients who are involuntarily committed. This is located at our LCA unit, and this is for people that are Tarrant County residents that are committed to long-term treatment. They would go there in lieu of that. The agreement is necessary to help offset the lack of capacity for the North Texas State Hospital in Wichita Falls, which is where our folks would go if there were beds, but there's not. Aligns with our district strategic plan to improve patient outcomes for adults with mental illness, as well as improve access to services for the communities we serve. This does provide an increase of $449,680 over in revenue over last year's agreement. It does carry a 60-day out clause with prior written notice.
Do a full panel analysis on these patients as we would patients that are being admitted through JPS as opposed to MHMR?
I'm not sure I understand your question.
Do we go through the same process of review for these patients as we would if they weren't coming from MHMR?
So what typically happens, Trent, is that patients are in TSP and move to the LCA because they've been committed.
Oh, okay.
Yes.
Well, they're ours in the beginning, and then
Periodically, there'll be others from the community, but typically the ones from the community are ones that we've transferred out as overflow on a contract because we're full here. And then they come back to the LCA bed. But they get the same, it's the same standard of care, the same level of care, and it's all provided by JPS staff and JPS physicians and providers. MHMR is their main responsibility as far as partnership with them with these beds is that they are able to help with discharge planning so that we can hopefully get someone to the next level of care in the community that's the least restrictive once they've been stabilized. We are using more IM injection antipsychotic medications that are helping stabilize people longer in the community, and MHMR does continue with the medication regimen that we found to stabilize someone when they do go into the community in their services.
so rough percentages, I won't hold you to it, of the folks that should be normally transferred by MHMR to Wichita Falls. What percentage of those end up staying here at JPS because the Wichita Falls facilities are full?
100%.
100%.
Yes, sir. Right now, and it's interesting you ask, I was in Austin last week, but right now, and this is statewide, it's not unique to Fort Worth, but all of the state hospitals have basically become forensic hospitals. And so if you are civilly committed, which are the type of patients we're talking about, you are unable to get into a long-term state hospital bed.
Wow.
And that is statewide. And also the other issue too is that because there are really no civil commitment beds at the state hospitals, there's also a huge backlog of forensic patients in county and jails across the state of Texas waiting on forensic beds at the state hospital. So a civilly committed patient is down here on the waiting list.
So what's going on in Austin this session? Because we heard prior to the session, we were finally going to do something to address mental health. I didn't believe it when I read it. Still don't. I know you're tracking it. What's going on to try to provide some relief here?
They have dedicated dollars to building some more state hospitals in Texas. They are dedicating more funding to community mental health centers as well. They are wanting to expand the community crisis beds, which are what our LCA, community state commitment beds, which are what our LCA beds are. We do have the capacity to expand maybe 8 more beds in our existing facility. However, the funding will need to be there in order for us to do that. A lot of, and some of the facilities that the state has built new or remodeled and updated are sitting empty right now because they're located in small rural areas in Texas and they're unable to recruit staff, like Kerrville State Hospital, Wichita Falls, Vernon. And those, Vernon and Wichita Falls are all of our catchment areas. And they have put dollars in to renovate Vernon and renovate Wichita Falls, but no increase in beds. So that doesn't help our existing problem here. And so I'm not sure, quite frankly, directly how JPS is going to benefit from any of these state dollars. We will attempt any way we can to benefit from them, but that's just Zelia's viewpoint, and I'll let Dr. Duncan fill in some blanks.
I was going to ask Ashley if she wanted to add anything further to Zelia's comment. Everyone remembers Ashley is our government relations. She's been in Austin quite a bit, has a long time standing with a lot of the elected officials there. So do you want to add anything and your thoughts?
Most definitely. So Zelia and I actually were in Austin this Tuesday. The Senate Finance Committee met for the first time and invited public testimony to participate. So this is the first time they've done that thus far this session. And Tuesday's testimony was all specific to Health and Human Services. So there were a wide variety of issues that were discussed. Zelia came and spoke specifically to behavioral health needs in Tarrant County. We highlighted the fact that our county does not have a state psychiatric hospital. We do have a few state beds. I think it's 30 currently that we operate, through the partnership with MHMR and HHSC. But there's a great need that still exists beyond the 30 beds we operate, the jail mental competency restoration program that's present in Tarrant County, that there's still very much a need on the forensic side, as well as the long-term programmatic or care side, if you will. So to answer your question, both the Senate Bill 1 and House Bill 1 that were offered in late January of this year by Chairman Bonin and Chairwoman Huffman, they allocate substantial more dollars, state dollars, towards broadly mental health, behavioral health programs. None of those dollars are specifically allocated to a state hospital for Tarrant County. The hospitals that Zelia identified have already kind of been in the works, if you will, from a more statewide plan that state leadership has been kind of going down this road for the past couple of sessions. That being said, the county itself, the Commissioner's Court, they are advocating for the state to put $15.5 million towards a study and planning for a potential state psychiatric hospital in Tarrant County. They're following the model that Dallas County started on a couple of sessions ago, and as y'all are aware, Dallas County has received funding for their facility, and that'll be built here in the next few years. So on the state psychiatric hospital side, that's where the advocacy's been focused from the county's perspective and the Commissioner's Court's perspective to get that conversation going and that process rolling. So that is the county's ask. We're meeting with legislators across the state, not only our Tarrant County delegation, but those members that are on committees of jurisdiction that are important to our issues. So in those conversations, we're talking about, again, what Zelia pointed out of, we're operating these 30 state beds, but we're not being reimbursed our cost to do so. We're operating those at about a $3 million loss per year. And we have capacity to potentially expand, but we and others that are in that same scenario, if you will, across the state, we're not necessarily going to take on additional debt to expand capacity, that we need more state support, and we need that reimbursement to come up to our cost or closer to our cost so that we can continue to provide that care and maybe even expand that care.
I think that, the facility in Dallas, good for them, right? But I would like to see us continue to present information on the process while the legislature's in session. And if we need to put a resolution adopted by the board just to show the solidarity behind the support that this issue become more public in terms of the Tarrant County need, and the fact that, it's great to have a beautiful facility in Vernon that's shiny and beautiful and empty with no doctors. There's just some basic fundamental flaws in this. And if, I would like for us to consider, maybe, Madam Chairman, as a board, to maybe push this a little harder from our standpoint and see if we can at least put a resolution up and say, hey, you know what, because I know our staff is doing everything they can. And thank you, by the way, for that.
You're
Because you're
welcome.
going to be down there more.
I'm going back next Tuesday. We're going next Tuesday.
I'm there weekly, and then the House Appropriations Committee, Article 2, they're taking public testimony this coming Tuesday, so we'll be back to offer similar comments as we did this week. I would certainly be in support of the board considering a resolution. We could talk broadly just about the behavioral health needs of our county, certainly be supportive of more state beds being brought to the county, but I think there's just some more broad terms that we could include in that
and
as well.
illustrate how Tarrant County residents have stepped up to the plate
Right.
when it comes to
Yes.
psych
Right.
emergency center and capital expenditures, much more so than anybody else has. I mean, we're doing our part.
Even inpatient, we're doing our part. Just
Right.
acute psych care, we're doing a lot. This county does a ton that nowhere else in the state
Yeah.
provides like Tarrant County does.
I just don't think we get the state's support that we should get.
Because we
Agree.
Because we've done so much, they assume we don't need the funding.
Right.
The additional,
Yes.
I mean,
Yeah,
when you're
so
figure
we
out
get
how
more
to
and more.
do it, you're not going to be
Right.
infused a lot of money and rewarded
Right.
for what you've done. So to your point,
Have we read into our state representatives on this? What's their position?
Yes, sir. So specific to a state psychiatric hospital, I know Russell with the county has had direct conversations with all of our Tarrant County delegation members, and they all are supportive of the county pursuing the study and the planning to get that conversation started. So,
Well, it's one thing to say they're supportive. The next question is, are they doing anything?
Right. Yeah.
Are they putting any legislation together, trying to get bills passed that would resolve
yes.
some of this?
So that is the county's ask. They are working with Tarrant County House members and Senate members to carry the legislation that would allow for that $15.5 million to be allocated to the study and planning for a state psychiatric hospital. So yeah, the county themselves are working through that process with the legislators.
And also the Meadows Mental Health Institute is also working on our behalf down there as well.
How do you have a facility in Vernon? That's a rhetorical question coming up here.
And now,
Put a whole bunch of money into and without knowing that you couldn't do anything with it once you built it.
well, they actually mentioned that at the Senate hearing Tuesday, that we've got new facilities and they're empty. The senators on the committee mentioned that. The speaker, Phelan, had mentioned that he wanted to expand local commitment alternative beds across the state. And I'm also on the Texas Hospital Association Behavioral Health Executive Committee, and we actually provide guidance to the overall THA board on policy for THA for behavioral health. And our entire executive council said that no one would expand those beds unless the rates were increased to at least cover cost. Because this is not a unique JPS problem. This is happening throughout the entire state of Texas.
So is the Vernon facility completely doors locked, or is it?
No, sir. They're operating in their existing physical plant, but the capacity is reduced because of staffing, and they want to renovate and rebuild, and not expand capacity, but just have a new facility. And but they currently don't have the staff to staff the beds they have, and neither does Wichita Falls. And we have 350 inmates in the Tarrant County Jail right now who are waiting on competency restoration. And some of them have been in that jail since 2020 waiting to get to a state forensic hospital bed. And the new hospital in Dallas County, they're only doing 25 forensic beds, which is not going to,
Not even close.
that's pouring gasoline on a fire, it's not. But at least it's some. And just so you all know, as far as civil commitment goes, Tarrant County adult patients will not be going to the Dallas County State Hospital. We will have an opportunity for adolescents to go there, which is great, but not adults.
So it sounds like a political decision was made instead of a decision based on the needs of the area. I think.
I learned that real quick as the commissioner of mental health in Alabama.
Yeah.
That it wasn't necessarily about doing the right thing. And that's why I'm glad I'm here at JPS and working with you all, because you all really care about what the right thing is. And that's an honor to work with y'all.
Have you thought about writing an editorial to the paper that would get, or whatever this thing is we call the Star Telegram right now, and put that forward to the community and make them understand what we're going through?
I have not thought about that, but certainly Dr. Duncan and Ashley and Bill and I can chat about that.
I would strongly suggest that without more public exposure to this, you're not going to see our representatives breaking their neck to try and do something. I think we've got to start putting some pressure on them from not just from this board and this hospital, but from the general public.
And if you all know any of them, please feel free to help us.
Don't forget to use the other one that Steve Montgomery talked to us, the business report. That might be an easier one to.
Well, I'm meeting with Tom Harris Friday. I don't know whether you all know where Tom Harris is, but he's out of Alliance.
He's great.
But he's been assigned to a city effort along the same lines. And so I'll see if I can't twist his tail a little bit on Friday.
Okay. Well, I think if there is a resolution that I would be willing to write it or sign it.
I really think the board ought to look into getting some kind of a article into the paper about this. Mental health is the most understaffed and undersupported part of our health industry. And more and more, particularly after COVID, more and more people are coming for those services and not being able to get them. So I think we ought to make this a focus of this board to go push every button we can to try and get this resolved.
Right.
$15.5 million to do a study
Study and planning, yes, sir. That's the first step in the process for the state to evaluate the current need in a given catchment area for behavioral health services.
I think he means more, 15 million.
Well, there's a lot involved in it, a lot of consultants, a lot of community stuff, and that's just typically.
Bev, why don't you and I volunteer for that job?
Can we take that 15 million, put in our planning committee, we can give them the report.
Yeah. One other thing. One other thing, we've gotten this question several times from legislators. You know, folks like to lump Dallas and Fort Worth together, and in this space, Tarrant County is not included in the Dallas County catchment area. So if you're asked about that, you know, in terms of won't Tarrant County be able to access significant number of beds at the new Dallas County facility, the answer to that is no, because we're not part of their catchment. We're in our own catchment with, I believe it's 52 other counties as defined by the state's catchment regional plans when it comes to behavioral health care services that the state provides.
How many is Dallas?
They've got, it'll be 4 or 5 in their
I
catchment
think it's
area.
5. I believe it's 5.
They got
On the
time,
surface,
we got how many?
that doesn't sound like it's an imbalance when you recognize the
Population, yes, sir. It's based on, correct, population.
52 is an awfully long stretch of the arm for us to support, too.
That's why you have Wichita Falls.
Correct.
That's that long
Correct.
stretch. That's
Correct.
yeah. Which doesn't make any sense for you to have it if nobody, you can't get staff, and the state is not looking at anything to increase that staff.
Or beds.
I know we talked about a resolution from the board, but what about from the commissioner's court also?
I would suggest that we get them to
They
jump
did.
on.
Yeah, I believe they
The
did.
Commissioners Court did.
Yeah. Yeah. They passed their own legislative priorities list and also did a resolution in support of the state considering, you know, their pursuit of a state psychiatric hospital being brought to Tarrant County.
In fact, if it was done by the right person on the commission, that would be a stronger push. So maybe we visit with Tim and see if we can't get Tim to take on that. The reason I say that is that if you do go to Roy Brooks, he's already got a set of baggage that he kind of carries around, and there's 2 new guys on the board. They're not going to help. So I think Tim is the one that needs to probably take the lead on this.
I meet with him next week.
You got an assignment, Chairman.
I will add that to my list, but I'm meeting with him, and so talk about how we can, our needs, and we can mention mental health, and see if that's something that he will. I didn't hear that as being a part of his platform, but I can ask if that is part of it. Yeah, we can ask.
Well, if we do.
Jumping up and down. We just got to start jumping up and down.
If
Listen,
we-
I mean, we're appointed, we've been sitting here, some of us for longer than I have dogs that have ever lived. And this issue has not gotten better at all. And we've been patient. I think we've done everything we can within the confines of the institution. But this is ridiculous.
Yeah.
It's ridiculous that more is not happening. And I pass a board resolution, you know, articles, I don't care what it is. I will be happy to go to Austin too. And I'll bring everybody that I can with me, because we're just not, this ain't cutting it. This ain't cutting it. And we're sitting here as representatives of the community on this board, and none of us are happy about this. None of us have ever, you know, or have been, we're aware of this problem, but we also have not been able to see any meaningful movement by the state. And I really, it even goes to broader political issues, and I understand that, but within the confines of what we can do with this issue, we need to do it.
Especially now,
Right.
Especially
where there's a
now.
lot of optics on it.
Yeah, so I would just challenge the staff, you know, tell us tell us. We don't know much, but we know a little bit.
We can give you plenty of
Tell
talking
us what we can
points.
do to help. And
It does present Tarrant County with a phenomenal opportunity, should we get a state hospital here, to really create a wonderful public-private partnership, with UNT Health Sciences, with our Acclaim group, with our residency programs, because we have a large residency program, and we've got 4 new adolescent child fellowship.
Wow.
Child and adolescent fellowships, and so we have a wonderful opportunity for it to be an excellent facility and to have a wonderful training opportunity for all types of physicians and other APPs and things like that, and other allied health sciences. So it's really, it's a great opportunity for the county.
I think
There's where we get our leverage. We can bring in other hospitals, our big academic centers into this conversation.
Yep.
I think that's where we really start to get our leverage. Again, I think we've done it ourselves. We've been respected for what we've done out in the community, but I do see this as opportunity to, there seems to be some energy out there with other hospital systems and academic centers to join the fight. So I think that we need to leverage that.
Well, the state's got the money this time.
Yeah, of course, yeah.
They do.
It always helps. That's right.
And there's, whatever we can do, I would ask you all, everything you can do to mobilize and operationalize this board toward that end, you're hearing there's going to be unanimous support for it.
Well,
Whatever we can do, let's do it.
truly appreciate that.
Very much so.
Sorry, I chased a rabbit.
That's okay. It's a great rabbit to chase.
It's been a good discussion.
I do have one more contract to present.
Did we finish this one?
Again, this is
We haven't taken action.
Oh, I'm
Can we
sorry.
do both at the same time? Is it MHM? Yeah, go ahead, and then we do both at the same time. Go ahead.
Oh, okay.
And did you say the P3 word earlier? The public-private partnership for that project?
Yeah. I did, because it really is a great opportunity.
Get some soap.
We could talk about, we can do internal medicine, we can do family medicine, we can do, it's endless. So the second contract would be for your consideration of approval for a professional services agreement for adult and adolescent crisis mental health services between MHMR of Tarrant County and Tarrant County Hospital District. This is a revenue contract for $1.68 million. And it is for 1 year. So this, MHMR gives us this money to help offset the indigent care that we treat in our PEC as well as TSP.
Any question, comment? If not, I have approval from our general counsel to combine those two.
Move approval for both contracts.
All in favor, say aye.
Aye.
Any opposed? Motion passed. Thank you.
Thank you all, and thank you for your support, and we're going to take you up on it.
Thanks, Celia.
Good morning, Dr. Miller.
Good morning, everybody.
Morning.
Sorry for my scrubs, but I am working in the ICU today.
Can we say it's Miller time? No.
It is Miller time every single day. Yes, sir. And I'm very proud of my company. I am here on behalf of Dr. Elliott and Diana Singer and GME to consider approval for first exemption to bid and a letter with prescription and license terms between UpToDate Incorporated and Tarrant County Hospital District. As you might know, UpToDate is our critical internet-based decision support tool that's integrated into Epic, and it's used 24/7 to help guide our patient care decisions across both the inpatient and the outpatient settings at JPS. All of our clinicians have found this to be a very quick and accurate information of our patient diseases and recommendations based on evidence, and is considered the gold standard for patient care information. Just a few items. In 2022, UpToDate was used 300,000 times through the network. 83,000 of those searches impacted the initial course of treatment. Most of them were used and originated in Epic, and over 13,000 continuing medical education and maintenance of certifications were claimed by JPS clinicians. The cost is $330,397 for year one, which is included in the approved operation budget. The total cost for 3 years is $1,070,532. Diana Singer and Dr. Elliott were able to negotiate a contract that was significantly less than the original increase in charges over the subsequent 2 years, from 18% down to 8% for years 1 and 2, and 7% for year 3. That's a 92% improvement over the original proposal. So I bring that consideration to you as the board, and I appreciate your time.
Any question, comment? I have a few questions for you.
Yes, sir.
Is around the exemption to bid.
Yeah.
Have we looked at other product like
Yes, sir.
from Athena?
So we did do a search of equivalent products. The one that actually is pretty good is called Dynamed. Dynamed is owned by EBSCO. It's a point-of-care decision tool that provides CME. The problem with that one is it's linked to IBM Microdex. Here at JPS, we have Lexicomp. Lexicomp is the interface between UpToDate and our JPS pharmacy formulary. That RFP with Lexicomp was approved and does not expire until 2025. Dynamed is not integrated into Epic. It's integrated into IBM, so we can't utilize that at this time and would have to require a major change. We do have one other company that we utilize, which is Milliman, which has now been changed to MCG Health, but that's a separate entity that is utilized by our department for medical necessity tool, and it does not at all overlap with UpToDate. So really, at least until 2025, we are sort of committed because of the interlink between UpToDate and Lexicomp with our pharmacy formulary to utilize that till 2025.
Okay. Have you guys looked at the Ipocrate from?
With what?
Is it Ipocrate? EPOCRATES?
Okay, I don't know about that
Athena.
one. Does anyone know about that one?
We have Lexicon interface also as well.
Well,
I would add that
Oh, it's a better product, I have to admit, but I just want to make sure that our exemption for bid is correct.
okay, UpToDate is definitely best in breed.
Right.
I mean, that's the best product out there for us. So from that standpoint, and I understand the competitive bidding, but the UpToDate is definitely the best that's out there now.
So to answer your specific question, the feature and functionality between the two are not analogous, and it wouldn't be a comparable product.
It would be?
It would not be a
Would not be a
comparable product.
Okay.
Well, is that because the integration into Epic that it's not comparable?
It has to do more with the curated knowledge bases that they provide.
All right, since it's a non-bid, I'm going to make several observations and suggestions on that. It's from a privacy and security standpoint, they don't have a role-based permission level. They're pretty weak from the user's review. And this may be just a suggestion when you negotiate with them later on, or roadmap with them down the road that they need to address, because this is part of their survey from their user. The other one is the database backup and redundancy is weak. HIPAA compliance is average. Local mode and network fail-safe is average. But it's obviously it's a better product, but it's very restricted also as well. So more alternative treatment methods may be some of the few suggestions for them for their roadmap, because we do have DO that have a little bit of holistic view and the flexibility there also as well. So, but those are comment for their product roadmap down the road when you have a chance to talk to them.
Certainly, and we'll be happy to look into that, particularly as we look at where we're going with bringing the two products together to try and look at the next generation of contracts. As far as the role base, we don't do a whole lot of role base at this point in time. The SIR records related to, the security records related to Epic are fairly generic, and so it would be very difficult to connect role base.
And we're not using this tool for patient scheduling, right?
No.
Patient scheduling, no.
Okay, because they have
Strictly medical decision-making.
Okay, because that part is weak.
Around, it's just it's like an online encyclopedia, if you will.
So you're not doing
it's what's embedded in Epic.
It's almost like a hyperlink. Think about it like a hyperlink. When you're in Epic, you can hyperlink into UpToDate. I mean,
But when you do drug reference, you don't do cross the drug-to-drug interaction, all that stuff within that product?
But it integrates with our formulary, so you can integrate UpToDate with our JPS formulary through Lexicom to get the medication that we have available for that patient.
But we don't need to do that then. Okay. All right. Thank you.
Thank you.
May I have a motion for approval?
Second.
All in favor? Oh, with the exemption to bid also as well.
Oh, okay. He took the bid. Exemption to bid, he did it. Exemption to bid.
Yes.
Amended, he did it. And I second it, okay?
All in favor, say aye.
Aye.
Opposed? Motion passed. Thank you, Dr.
Thank you,
Miller.
sir.
They have GPT-4 now.
Yeah, that was awful.
Oh, Julie, it loves you.
Yes.
That's the latest thing ChatGPT is doing. I'll take that.
All right, Bill. You're next.
All right.
Yes, please, go ahead.
The last I'm presenting a contract here that relates to the sale of the land next to Jessica in Arlington. And as a reminder, at our last planning committee meeting, we went over our Arlington strategy, and this sale is consistent with this. And additionally, back in July, not long after I started, July 28th, we went into closed session and talked about all the real estate that we were going to do and got a recommendation to proceed with the sale of this. So and this property's been listed for sale for some time. If you look down in the bottom left corner, you can see the property we're talking about right next to Jessica. That's the sales sheet from CBRE. We actually got a price of $4.3 million. We had an initial bid from the same company of 3.9. They increased to 4.3, and then a competing bid for 3.35. And if I show you this other document, this is, sorry, I scan in my document, so it's maybe a little hard to read, but I just wanted you to know this is at the high end of the, if you look in the very top there, CBRE provides a value of what they thought it would be potential reach, and their potential reach was 3.9. We're offering, we have an agreement at 4.3, so we're recommending to proceed with this agreement because it's at the high end of our potential value, consistent with the strategy we presented last week, and was decided by the planning committee for as part of our real estate plan to not own this land anymore.
Any discussion, question? If not,
13.
Right.
So I'd make a motion that we approve.
Second, okay?
all in favor, say aye.
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 All opposed? None. Motion approved. I don't believe we have anything in closed session. May I entertain motion for adjourn? No second, we'll be here for a while. Any second? No? All right. We are adjourned. Thank you so much.